Hello, I'm Dr. Tom Oakley. I'm the CEO of Feedback PLC. Today I'm going to take you through Bleepa, our key app, and we will be showing you all the amazing clinical features within it. Here we are within Bleepa. You can see all the patients as a list. Each of these patients is under my direct care and I have some involvement with. I'm now going to go through Arnold Smith, who I've been asked to review. So when I click on Arnold Smith, I can go into their imaging, and here I'm going to review one of the brain MRIs that's associated with him. So here you are, you can see the clinical quality of the imaging. I can interact with it, so I can zoom in, I can move the image around freely, looking in detail at the features that I want to find out more about. You can see here the anterior, posterior, left and right markers to show that the image is appropriately orientated. And I'm just going to change the preset window levels so that I can more easily interpret the image. And now I'm going to scroll through the image to pull out the detail about the case that I want to assess. And you can see some pathology beginning to creep up here. And now if I wanted to actually highlight this to some clinical colleagues and ask a question about it, I can easily do that by selecting Mark, the annotation color that I want, and then drawing the annotation over the area that I'm concerned about. Now I can easily move that around, I can change the orientation of it, and I can extend it, make it smaller, anything that I need to do to be able to highlight the exact thing that I'm looking at. Now by clicking here, I can add a clinical question to one of my colleagues. And that will then appear in a chat feature that allows me to ask that question to anyone else who's in the clinical care of that team. That may be nurses, it may be other doctors, it may be specialist radiologists who can give me the advice that I need. And now I'll show you that arriving on one of our other devices. So here we are inside Bleepa, just to show you how messages are transferred. If I just scroll through until I find Arnold Smith, I can click on that. Here's the question that we've asked. What is this? Here you can see a little thumbnail of the image. All I need to do to be able to see the image and the question relating to it is click on the thumbnail. It will go straight through to the image in question and the annotation, and then I can quickly and easily assess the image and go back to the clinician with my answer. And this is a demonstration of the image arriving on a different device. We just go to the patient in question, Arnold Smith. Again, here's the comment, what is this? Here's the thumbnail, we just click on that, go straight through to the image in question, and it will highlight the area that we're asking the question about. I can now review this and go back to my clinical colleagues with an answer. So I've now been asked to review Janice Evans, who has come in with an angiogram. And angiograms are particularly interesting studies because they're often most helpfully viewed in a movie. And here you can see the loading movie feature within Bleepa, which will allow me to then view the file as a film screen. And here you can see the angiogram running as a video. I can move between series seamlessly in movie mode. And now you can see the new series playing through. Now, moving out of Janice Evans, I've been asked to have a look at David Jones. This is an example of a larger study with multiple slices as part of a CT, almost 600 slices in fact. And this is to show you just how easy and versatile Bleepa is to use. Again, I can zoom in, I can zoom out, I can change the window presets, and I can scroll seamlessly through the slices. And just as we did before, if there is an area of interest, I can annotate, add a comment, and then share that with a group.